Small ARULMO is ARULSIGA.
Good morning, friends. I like to welcome you all to this webinar. First of all, I like to thank the Almighty God for giving one more day in our life. Next, I like to extend my thanks to the patrons of our St. Joseph Group of Institutions, our chairman, Dr. B. Babu Manoharan, Managing Director, Mrs. S. Jessipriya, Director, Mr. B. Sasi Shekhar, Principal, Dr. Vaddi Seshagiri Rao, and Dean Research, Dr. B. Parvadavardhani, and the convener and Professor and Head of Science, Dr. V. N. Nandini Devi. Without the support and the encouragement of them, this webinar will not happen. Thank you once again. Now I hand over the session to Dr. P. Krishnan to introduce our resource person.
Thank you, ma'am. Hello, everyone. I welcome you all for this webinar, and I'm extremely sorry for this inconvenience due to some technical error delays. I'm really honored to give an introduction about the speaker, Mr. D. Shantakumar, founder and director, Cornerstone Devices Private Limited. He's an effective and result-focused entrepreneur with 30 years of experience in sales, marketing, service support, production, and D&D in medical devices industry. He's having long-term relationship with overseas manufacturer, distributors. His expertise in various areas such as sales and business development, managing technology transform, strategic and market planning, managing service support, building and managing distribution, startup incubation, key account management, training presentation. And he did his BSc in Physics and Electronics from Cochin College, Kerala. He did his postgraduate in Diploma in Digital Electronics from Madras Christian College. I would like to mention some of his importance overseas exposure. He was a part of intensive care ventilators, biomedical Switzerland, dialysis machines Germany, blood gas, electrolyte analysis UK and USA, and also in various countries like Singapore, Malaysia, and France. You were in different positions from 2011 to 2020. He's a founder and director of Cornerstone Devices Private Limited. Uh, he was a director and founder Vital Instruments Private Limited from 1991 to 2018, and also he was a chief consultant and founder of Neo Dynamic Solutions from 2001 to 2017. You were in various positions like sales, service engineer, service manager, manager, and R&D from 1987 to 1991 in IMI Medical Private Limited. And also he is in other activities like training and marketing trainers, engineering college students, and he is a member of Board of Studies in Avinas University, Coimbatore, ABW Engineering College, Coimbatore, Women's Christian College, Chennai, KPR Engineering College, Coimbatore. He has done over 200 hours of lectures, imparted leadership trainings for nine years. With this short introductory, let me hand over the session to the speaker, Mr. D. Shantakumar.
Thank you so much. So it's a pleasure and a privilege to be speaking to you all. Again, I want to apologize that there was some technical hitch and we were not able to get the PPT on. But like someone said, the PPT is not what you see on the screen, but the PPT is something that is in the mind and in the heart. So whether PPT or not, I think the content that I have is what I'd like to share with you today. But I'm really glad that all the management staff were able to get this done together, and thank you for taking on the PPT work and setting it up for me. Just want to thank the college for this invitation and for the opportunity to talk and share my heart with you all. My heart has always been in ensuring that students are equipped to come into the industry and do it effectively. There is no proper bridge course that will enable the student to go from the university to the industry in an effective manner, and therefore there is a lot of training and internships and all kinds of opportunities that are available. But there is something that we always have found lacking in this whole scenario, which is the larger picture, and that's what I am actually going to be talking to you about today. My talk is typically going to be in three parts. The first part is going to be about what is going on today. And then I'll talk a little bit about what it means to be in this journey of student to entrepreneur. And then I will talk about my own journey, which is typical from the current company that I am handling. So if we can look at what is there on the screen today, I think this is something that all of us would identify with. So we are talking about the current news. The current news talks about the pandemic, it talks about COVID, it talks about lockdown, it talks about a crisis. There is a lockdown, there is the whole world has come to a standstill. There is a global crisis, there is an economic crisis, there is a crisis in production, in productivity, in education, in all spheres of life. There seems to be a huge crisis. Now, I just want to put us back into the right perspective of where we are. And I just want to ensure that we understand that this word crisis is not a bad word. Now, so I just want to take you through what is currently on, and then I will transition to what the journey is from a student or a non-entrepreneur to an entrepreneur. So next slide, please. So when we look at this word crisis, the world, we say, is in a state of crisis, but I would like to say that the world is not in a state of crisis. The world is in a state of flux. What is this flux? Flux means change. The world is in a state of change, and we are not expected to manage the crisis by ourselves, but we are called to manage the change and to change quickly. Now, this is what is expected of you and me. Now, we are going to play a part in all this, but we are not expected to manage the entire crisis because we can't do that. But we are expected to manage ourselves and our close environment as we manage the change. So think about this and remember this. This is not only for today's scenario, because today we are facing COVID. Tomorrow you may have a mini crisis in your own life, which may not be common to others. So remember that crisis is not about just a hardship. Crisis is about a change. This is something that is actually a good thing, because if we manage crisis well, if we manage change well, then you're on your way to success. Next slide, please. So who are entrepreneurs? What do they do? And what is it that the crisis brings out in entrepreneurs or innovators that helps them? I just want to show you a few examples. If you can go to the next slide. During the Long Depression, that is 1873 to 1896, look at the innovations that happened. The light bulb was invented during that time. The steam turbine, the transformer, the radio, refrigerators, all stuff that we still use was invented during the Long Depression. And that's the time when people thought that they were in a standstill, nothing could be done. And here these innovators and entrepreneurs rose up and they were able to invent stuff which we still use today. Look at the other one, which is the Great Depression, 1929 to 48, during the World War. So look at the innovations that happened. These are just a small snapshot. I'm sure that there are thousands and thousands of innovations that happened, but just a few of them here. The tape recorder, the helicopter, nylon, which we still use, ballpoint pens, which is used by everybody all across the globe, was all invented then at that time. Terylene, which is a polyester. So all these point to a fact that when there is a crisis, or when there is a change, when there is a flux in the situation, there is a requirement for people to come up and innovate and become entrepreneurs. Next slide, please. So what do these entrepreneurs do? What do innovators and entrepreneurs do? They perceive a need and find a solution. They perceive a need and find a solution. And that's very, very key now, especially in a crisis or in a time of flux. So you see a huge need. There are so many needs that we see, and the innovator or the entrepreneur, they just grab that opportunity. They see that perceived need and they find a solution. They create a product. And then they take it to the market. They make a market impact, and just one more click, and then because of that, they successfully commercialize the product. Next slide. So this is something that you and I need to remember as we think of who an entrepreneur is and how that entrepreneurship can be developed. And more so now than any other time, because in a time of crisis or in a time of change, in a time of flux, the needs become huge. So I'll just explain a little bit about that, and then we will see how this journey of an entrepreneur can begin and end successfully. Next slide, please. Okay, the first thing that happens in a crisis situation or in a time of change is many times people get depressed and they think that they are not able to do anything. Now that's the time that you will need to sit down and do an evaluation. Now, many of you, I'm sure, have seen the SWOT analysis. A SWOT analysis is nothing but a 4-quadrant tool that will help us to understand where we are and what we need to do. This is something that you can use in any situation. Now, when you're looking at any situation and any type of circumstance, the first thing that you'll need to very quickly do is do a SWOT analysis. Now, what is SWOT? S is strength, W is weakness, O is opportunity, and T is threat. Now, for those of you who are able to see the screen, you will understand that strengths and opportunities are always helpful. Weakness and threat is always harmful. Again, if you look at the horizontal way, you will see that strength and weakness are internal. So strength and weaknesses are from within, whereas the opportunities and threat are external. These are because of the circumstances, because of decisions that somebody else took, things that are happening around. So strengths and weaknesses are within, and opportunities and threats are outside. So remember this and look at how this will be applicable to you. I'll just show you a few examples. Let's go to the next slide, please. So typically in a situation, we are called to look at the entire SWOT, not just the weakness and threat. But typically what happens is that we look at the weaknesses and threat and get scared because of that. Now let us look at this COVID itself. What are the impacts that this has? There is a human impact. So there is death, there is sickness, there is contagion. We always keep talking about the fact that there is no vaccine. There is no cure, there is no treatment, there is quarantine, there is social distancing. Many times you cannot go out as you wanted to. There is no proper entertainment, you can't attend events, food, shelter, transport. There is problems with mental health, there is stress, and so on and so forth. I mean, the list is endless. So this is something that we think of as threats. Next slide, please. And then there is the economic impact. We talk about what is going on with the corporate world. It is not doing well. The MSMEs are not doing well. Manufacturing has imploded. It's not doing well. Travel, tourism, entertainment, food, all those industries are doing very poorly. Even healthcare is doing poorly because the doctors are all busy fighting COVID, and patients are finding it difficult and they are scared to come to the hospitals. So both the healthcare segments as well as the other segments are not doing well. Banks, financial institutions, governments, and even our own personal finance and investments and savings. All these are at a point where we feel that it is a huge threat. Now let's look at the other side of it. Let's look at the next slide, please. Weakness. So we look at what are the weaknesses that this COVID situation has unearthed. So we see that there is a weakness in the medical facility, the number of hospitals, the number of hospital beds, the infrastructure, all that has shown up a weakness, even though in our country and in our state it has been handled very well. Then there is the problem of healthcare delivery system in this crisis. And then there is the number of doctors, nurses, or paramedical staff. All that we are seeing as a weakness that has been exposed because of this pandemic. Then there is a lack of enough testing, of diagnostic systems, of quick validation of vaccine treatment. Even today, we read in the newspaper that now FDA has done a quick transition for the treatment and also the testing method. So these are all we see are weaknesses that has been exposed by the flux or the change or the crisis. Next slide, please. Okay, so again, when we look at the weakness, we see that there is a lack of the equipment, ventilators, masks, PPEs, infrared thermometers, kits, and so on. And then tools for isolating and treating patients, that's also a weakness that we have seen unearthed. Sanitation, lack of awareness, hygiene, disinfection, and then quick delivery of services and devices to the end user. That's also has been a problem. And we didn't see much in terms of true innovations except in the last couple of months now. And research itself in India has been very, very lacking. So these are all things that we perceive as weakness. Let's go to the next slide and see how we can look at it as a holistic picture. Now, I would look at all those things that we thought of as weaknesses and threats as opportunities and strengths. So let's look at some of the opportunities. Now, because there is no medical facility or lack of medical facility or reduced medical facilities of hospital beds, infrastructures, and so on, many have come up with innovative ideas of utilizing apps or platforms that will bring in all the hospital beds in single a platform when they can aggregate all that and then allocate hospitals and beds and infrastructures according to the requirement, according to the location. Now that's an amazing app and platform that has been developed through this crisis. Healthcare delivery system has also thrown up a few innovations, and many have come up with platforms where you can aggregate and solve these issues of delivery of medical equipment, delivery of services of technicians and paramedical staff, and all that through platforms, through apps, and through many, many methods and processes that were not there before the pandemic. Next slide. So if you were to look at the testing and diagnostic systems, you can also understand that there are many methods and ways that in which across the world, all countries are working towards this, starting from India to the US to Europe to Southeast Asia to Japan. Across the world, people are working at quick validation of vaccines as well as treatment and diagnostic systems for the COVID situation. So as you can see, what we thought were threats are being converted to opportunities. Now, again, like I said, all these methods have thrown up opportunities in the healthcare delivery systems. So next slide, please. What else has happened? Even the equipment industry that I am in, medical medtech industry that I am in, there have been at least 20 institutions across this country that have worked on making ventilators. And then there are umpteen number of manufacturers of masks and PPE kits and even infrared thermometers. I know of at least 5 or 6 companies within India who have developed our own technology for making infrared thermometers. And then we have also come up with tools for isolating and treating patients. awareness of sanitization, hygiene, and disinfections. These are all things that even my own company has got into now. I had absolutely no idea of about disinfectants and even chemistry itself. But during this pandemic time, I had an opportunity to study that deeply and come up with a couple of solutions that can be a long-lasting method of disinfection. So we have at least three innovations in the disinfectant field. Now, to do with quick delivery of services, our company is working on a platform and an app that will help doctors and end users of medical devices to have quick access to devices as well as services. In fact, if there are questions, we have a method of quickly addressing those questions just by connecting to the internet and going on to a website and getting those answers very quickly. And now you see true innovation and research is happening within our country as well as globally. So, as I mentioned, when you do a SWOT analysis, the weaknesses and threats can quickly be turned into strengths and opportunities. I want to say this again because there will be crisis situations, there will be situations of change in your life again and again and again. And so instead of looking at it as a crisis or as a threat, I would suggest that you look at it as an opportunity and a method to improve yourself and strengthen yourself and address it so that you can become successful as an innovator and as an entrepreneur. Next slide, please. All right, so that was something to do with how you can use a crisis or a change situation to truly go up from looking at it as a threat to turn it into an opportunity, to turn a weakness into a strength. And so let's look at this journey of moving from a student to an entrepreneur. So when you start off, you probably think or come up with an idea or a solution, and you are imagining that you can move from there to becoming successful. Let me tell you that there is a journey, there is a process involved from moving from a non-entrepreneur to a successful entrepreneur. I've done this all my life, most of my life, and so I can give you a few tips on what not to do and then a few tips on what you can do. Next slide, please. Okay, so the first thing is you look at an opportunity or an idea. I call it potential. And from there, we go on to what we call a purpose. Now, we need to clarify in our mind what we are thinking and is it in tune with what my goal is. So that is purpose. So you have a potential. You ensure that purpose of that potential is also your goal. That is purpose for yourself. And then there is this next step of preparation. So after preparation, you go on to build partnerships in order to take it to the next level. And the next step is power or power on, as I would like to call it. Once you start off this journey and then you power on yourself or your entrepreneurship, then the next is persistence. You need to keep working at it till you come to that end goal, which I would call a product. Now, this is true of almost any entrepreneurship journey. So you start with an idea and you're looking at impact. You are starting with a product idea and going to build a product. You are thinking of a methodology, which is a potential, and turning it into a successful venture. So these 7 steps which I've outlined to you, I'll just explain a little bit about each of them, and then we will look at a case study of what we did ourselves. So next slide, please. And just do one click on the next slide. So there you see a little boy there. Any of you have any idea who this is? Probably not. This boy was born in Austria and went on to become one of the most famous persons that everyone across the globe would know. Next click, please. Now, most of you know this guy, that's Arnold Schwarzenegger. Arnold's ambition or goal started off when he was a small boy, and he kept dreaming that he would go on to be the best bodybuilder in the world, and he would go on to the US to become a Hollywood star. And so the next click, you will see that he is a star, and he continues to be a star that people love and enjoy watching. Not only that, he also got into politics, and so he became the mayor of California. And so this whole journey started off when he was a young boy, and he had a dream which he made his life goal, which was his purpose in life. And because of that, he was able to convert his dream into a reality. Next slide, please. And so purpose is very important. Now, purpose is very important. It's important to have a dream. It's important to make sure that that dream is syncing along with your goal and purpose in life. But the next one is preparation. You need to prepare. You need to work at it. Here's where you put all your questions. Now you keep thinking about who, where, what, when, why. You need to question yourself. Keep asking. Ask. Work. This is your preparatory phase. You're planning. You're asking. You are looking at the technologies that are available. You are looking at potential competition. You are looking at who the market is. Where can I sell it? Who will buy it? For what will they buy it? What will be the value? How will this whole thing work? Now, so ask a lot of questions. Next one. So not only do you ask, but you also keep seeking answers. The next one. So when you keep seeking, you will find, because as you keep seeking, you have so much today in this day and age of knowledge. And because you keep seeking, you will certainly find. And then the next one is keep knocking. Now, everything doesn't come easy. The harder you work, the better you learn. The better you learn, the better person you become. And the better person you become, you know that from that experience, you can take it to your next project. So keep knocking till you are able to get an answer. Now, I was speaking to someone a couple of weeks back who had one of the most successful businesses, and who is investing into startups today. And he told me that for his first pitch to get Series A funding, he had to talk to 200 investors before one was willing to invest in his company. 200 investors, meaning he would have shortlisted those 200 investors from maybe 500. So there is a lot of knocking that you will need to do before you can be successful in raising funds or doing a sale or even getting some information. Next. So ask, seek, and knock. That's a good concept to always remember. And the next is to collaborate. Now, once you have your basic plan in place and you have come to the next level, you need to collaborate. You cannot do everything yourself. You do not have the skill to do everything yourself, and therefore you will need to collaborate. Find people who are not always like you, but find people who have a passion to do what you are calling them to do. So collaborate with people who are like-minded, but who are different in their skill sets. So someone has very beautifully said, there can be a dreamer, there needs to be a one who executes, there needs to be one who is a networker, there needs to be one who is a salesman, and so on. So your team will need to come together and do the thing that they are really good at. And not only that, you continue to learn. So teamwork is important, but the team also keeps learning and cross-functioning, working together in order to take the product or the concept to the next level. So partnerships are very important. Collaboration is very important. Next one, please. Okay, so once you have these, the next is to start. Now, this is where many people are very, very hesitant. They keep delaying this because they always feel that they are not ready. So you may have aligned your goals with your idea. You see the potential, and then move on to the next step, and the next step, and the next step. You have planned, prepared. You have got your people together, and then when it comes to powering up, when you're ready to start, there is a feeling: can I take this risk? What if? What if? Don't let the what if stop you. Just start. Put everything into what you have and jump onto the next slide. Okay. So start up. Don't delay. Next slide, please. And so once you have started, it is like you get onto a treadmill. You just keep running. You just keep persisting, keep following, keep working at it, keep going on and on and on and on. Persist till you succeed. I like the anagram that is there, up on the screen. It says follow one course until you succeed. So that's a focused view. So you focus on what you are working on till you succeed. There may be setbacks. I won't even say there may be setbacks. There will be setbacks, but every setback is a setup for a comeback. So keep persisting till you hit success. Next slide, please. All right, so you remember those 7 P's there? So you see the potential first, align your purpose, then there is time for preparation, bring in partnerships, then power up, persist, keep going on and on and on in spite of setbacks till you reach your final goal, till you succeed. Okay, so I want to leave that with you and then go on to the next slide, please. So these are some of the questions or doubts or worries that you may have. As an entrepreneur, I don't know anything about business. Doesn't matter. You can still be an entrepreneur. When I started my first business, I didn't even know that it was a business. I was fresh out of school, and during my summer holidays, there was an opportunity that I took up. Somebody wanted a public address system. I built it for them. They paid me money. I didn't think of it as a business, but it was a business. Looking back, I was an entrepreneur when I was 17 years old, but that's what business is about. You don't even need to know anything really about business as long as you follow the rules that we just looked at. Then you may say, I'm afraid that I will fail. Don't worry about it. It's always good to fail because you can learn and do it better the next time. You may feel I don't have funds to start up. That's okay. If you have a good idea and if you are convinced, finding funds is a very, very small part of the entrepreneurial journey. You may say, I don't have a lot of time. If you have the passion, you can have a stretched time. You will always find time for what you're passionate about. You may say, I don't have a team, but when you have a passion for what you're doing, the team will gravitate towards you. They will come towards you and you can work together and make the product or a project successful. You may think that I am not well connected. Now, that doesn't matter. Connections will come when there is passion. And you may say, I don't have a plan B. It is good not to have a plan B because it is better to stick to plan A and work on plan A without thinking about plan B. You may always hear that it's always good to. That's okay, but it is better to focus on plan A and do it right than go on to plan B. Next slide, please. Okay, so as a case study, I just want to tell you a little bit about who we are and what we journey actually started when I was probably 17 years old. I never thought of it as a business, but then since then I have had about 9 startups, and out of the 9 startups, I think the ones that really became successful were the ones that maybe 3 of them. And so basically the three which are there today are Vital Biosystems, which I still run, Neodynamic Solutions, which is still there, and finally Cornerstone Devices, which was started in 2017 February. Now, Cornerstone Devices is a company which for which we had a vision to empower clinicians for early detection and treatment of cancer. Next slide, please. So that was a vision for us, and from that vision there was passion and there was preparation. And so here's the preparation that we did. We did a lot of study on the cancer statistics. What are the cancers that are typically really affecting humanity, looking at India and across the globe and everywhere. And we were also looking at what are the technologies that are today available that will take care of the same idea that we had. There were very few. And then we looked at what is adaptability. Would interventional radiologists be interested in using this technology? Will it help them or will it cause them more difficulty? So we did a lot of preparatory work. So there was a lot of preparation and planning, a lot of questions. Ask, seek, and knock came into picture, and we talked to a lot of end users before we consolidated what the product should be like. Next slide, please. And so one of the things that we saw as a huge problem is that is of early detection of cancer. So I'll just very quickly explain what this is. It's a CT guided intervention. So when you're doing a biopsy or an ablation, which is treatment, or pain management, you need to put a needle into the patient. Now a CT scan is done of the patient. The point of interest is clearly marked, where the cancer is, where the growth is, and then this is kept in the mind of the doctor who's doing the biopsy, and he goes into the CT room and then places the needle into the patient based on the CT image that he remembers. Now that's not very accurate because you cannot exactly put the needle into the patient. So our device helps the doctor to accurately. So typically doctors used to have to try 4 to 5 times before hitting the point of interest. But with our device, they can do it the first time and do it accurately. Typically earlier they could only target lesions which were 10 mm and more. With our device, they can do it even a 2 mm lesion. So that was the whole point of the project. And so some of the problems that were there in the whole process earlier was that multiple needles had, needle insertions had to happen. So there was pain for the patient. There was multiple CT scans that had to be done, and therefore there was extra radiation for the patient. There was a risk of touching or hitting the vital organs. So the procedure time was longer. There was a risk of patient mortality. Then there was also suboptimal diagnosis for this whole thing, and because the lesions had to be big before you could actually take samples, so the cancer would have progressed before you could really diagnose. So these were all problems that we were addressing with our device. Next slide, please. And so we also looked at what is the market size. So we understood that there are about 100,000 CT scanners, and that is growing. And so at least 4,000 to 5,000 CT scanners would be included every year. So this means that there's a huge chunk, and only 1 or 2% of this entire population of CT scanners had any type of guidance system. And so we saw a huge market out there which we could address. And so we had this opportunity to disrupt the onco-radiology segment and empower radiologists to practice intervention that could really make an impact. So it would be a risk-free or reduced risk interventional procedures that would help in early diagnosis and treatment of cancer. Next slide, please. And so that's the two of us. Dr. Roy Santosham is the interventional radiologist and also the innovator of the product, and I come from the business angle. Next slide, please. And the rest of the team, that was a small team that we started off with. We had just one coordinator who was employed. Everybody else was a consultant. We had a product consultant, another one who developed the product. We had an industrial designer. We had the regulatory person, and also had the finance person. So this was our first team. And then as we grew, our team also increased. Next slide, please. And when we talk about team, we also talk about key opinion leaders. So we had people from across the globe to come and see the product. So we had very renowned people from Japan, from the US, from South Korea, from the UK, and at least 12, 13 doctors from within our country who all took a look and gave inputs for us to fine tune the product. Next slide, please. And so that's the journey that we had. The product concept actually happened in 2015, and then to create the first iteration or the first prototype, do many studies on a phantom or a mannequin, and then to do human interventional studies, and then to be incubated in IIT Madras, get a BIRAC grant through Department of Science and Technology. We won several innovation awards during the whole process, and we had some of the best opportunities to present our product even in RSNA, which is the most sought after show across the world in radiology. And also to file patents. Our Indian patent is also already been granted. We have filed in the US, Europe, China, and other places as well. And so this is some part of our entrepreneurial journey for Cornerstone Devices. Next slide, please. And so that's a snapshot of what we intended to do after 2019 and this year to 2020. But even in 2019, we were able to forge a partnership with a large corporation, and they have licensed the product. So that's the scenario of what we did with Cornerstone Devices. Now, if you looked at the journey, you would have seen that we went through all those processes that I talked about. You remember those 7 P's that I talked about? We first saw the potential, ensured that it was our purpose, and then we looked at the preparation, we looked at partnerships, and then we powered up. We took our risky leap into the field, and then we continued to persist for many years before it became a product, and that product became successful. And so that's something that I want to connect with what we did as a case study and what you as an entrepreneur or a budding entrepreneur or wannabe entrepreneur can also do. Next slide, please. So as you do that, think of it as an excellence perspective, that you take your product or your potential or your idea, purpose it with your goals, your convictions, have passion for it, go for preparation, which will be in-depth planning, and then you ensure that there are proper partnerships, make sure that there are people who are thinking like you but who have different skill sets. Power up, have courage, and jump into it. Persist in what you do, be fully committed to what you do, and I'm sure that you will see success, you will see impact, and you will see a product that will go out into the world and make an impact for society and for yourself. Next slide, please. All right, so that's all that I have, and I thank you for your patience in listening. And if you have questions, I'll be happy to answer them for you. Thank you. If you would like to put something in the chat box, that's fine with me. I can take questions. Also, if you would like to have, ask questions and get some answers outside of the session, you can always get it through the college, and I'll be happy to answer those as well.
Sir, thank you, sir. Thank you, sir. Thanks a lot.
Thank you.
Yes, sir. On behalf of Department of Science Organizing Committee, I extend a really hearty vote of thanks to our chief guest, Mr. D. Shantakumar, who spared time from his busy schedule to grace the occasion. Today, we had an opportunity to hear your thoughts, and this will surely be going to encourage us in our future events. First and foremost, we would like to express our sincere gratitude to our most respected chairman, Dr. B. Babu Monagaran Sir, St. Joseph Group of Institutions, for his consistent encouragement and providing an inspiring environment for such educational developments. Also, we would like to express our heartfelt gratitude to our Managing Director, Mrs. S. Jesipriya Madam, and our most respected Director, Mr. B. Shashishekhar Sir, respected Principal Dr. Vaddi Sheshagiri Rao Sir, and Dean Research Dr. B. Parvatavardhani Madam for giving us their support throughout this event. Last but not least, our respected head of the department and convener of the program, Dr. B. N. Nandini Devi Madam. She helps us to execute the ideas and giving us necessary moral support. I'm happy to express our thanks to all the participants. Thank you. Thanks a lot.
Thank you.